Welcome to this video about congenital valve malformations, specifically focusing on conditions like bicuspid aortic valve. We'll explore what these conditions are, how they develop, and what can be done to manage them, providing a comprehensive overview for those seeking to understand this important area of heart health. Congenital valve malformations, as the name implies, are heart valve defects present at birth. The exact cause is often multifactorial and complex. While some cases are linked to specific genetic mutations, the majority arise from a combination of genetic predisposition and environmental factors during fetal development. Factors such as maternal infections, exposure to certain medications, or underlying maternal health conditions can also play a role in disrupting the normal formation of the heart valves. Let's delve into the pathophysiology. Normally, heart valves ensure blood flows in one direction. In conditions like bicuspid aortic valve, the aortic valve only has 2 leaflets instead of the usual 3. This structural abnormality affects how the valve opens and closes. It can lead to stenosis, where the valve doesn't open fully, obstructing blood flow, or regurgitation, where the valve doesn't close tightly, causing blood to leak backwards. Over time, the heart has to work harder to compensate for these issues, leading to potential heart failure, enlarged heart chambers, and increased risk of aortic aneurysm or dissection. Congenital valve malformations affect a significant portion of the population. Bicuspid aortic valve, for example, is estimated to affect 1 to 2% of the population, making it one of the most common congenital heart defects. Prevalence varies somewhat depending on the population studied and the methods used to detect the condition. It's important to note that many individuals with bicuspid aortic valve may not experience symptoms until adulthood. The signs and symptoms of congenital valve malformations can vary widely, depending on the severity of the defect. Many individuals, particularly those with mild cases, may be asymptomatic for years, or even their entire lives. When symptoms do appear, they can include shortness of breath, especially during exertion, chest pain or discomfort, fatigue, lightheadedness or fainting, palpitations, and heart murmur detected during a routine physical examination. In infants, symptoms may include poor feeding, failure to thrive, and rapid breathing. Diagnosing congenital valve malformations typically involves a combination of physical examination and diagnostic tests. A stethoscope can detect heart murmurs indicative of valve abnormalities. An echocardiogram, which uses ultrasound to visualize the heart, is the primary diagnostic tool. It allows doctors to assess the structure and function of the valves. Other tests, such as electrocardiograms and ECG to monitor heart rhythm, chest X-rays to evaluate heart size and blood vessels, and cardiac MRI or CT scans for detailed imaging, may also be used. While we've focused on bicuspid aortic valve, other types of congenital valve malformations exist, each with its own characteristics. These include pulmonary valve stenosis, where the pulmonary valve is narrowed, obstructing blood flow from the heart to the lungs; aortic valve stenosis, caused by a thickened or fused aortic valve; mitral valve prolapse, where the mitral valve leaflets bulge back into the left atrium; and tricuspid atresia, where the tricuspid valve is missing. The specific type of malformation determines the challenges and approach to care. Treatment and management strategies depend on the severity of the valve defect and the presence of symptoms. Mild cases may only require regular monitoring with echocardiograms. More severe cases often require intervention, which may include medications to manage symptoms such as heart failure or high blood pressure. Surgical repair or replacement of the valve may be necessary in cases where the valve is severely stenotic or regurgitant. Minimally invasive procedures, such as transcatheter aortic valve replacement (TAVR), are becoming increasingly common for certain types of aortic valve disease. Currently, there's no definitive way to prevent congenital valve malformations entirely. However, certain measures can reduce the risk. These include ensuring women receive proper prenatal care, avoiding exposure to harmful substances during pregnancy, managing maternal health conditions such as diabetes, and considering genetic counseling if there's a family history of congenital heart defects. The prognosis for individuals with congenital valve malformations varies widely, depending on the specific defect, its severity, and the presence of other heart conditions. With early diagnosis and appropriate management, many individuals can live full and active lives. Recent research is focusing on identifying genetic markers associated with these conditions, developing less invasive surgical techniques, and improving long-term outcomes. For example, advancements in tire technology continue to expand the options for patients with aortic valve disease. Understanding the long-term risks of valve degeneration and developing more durable valve replacements remain key areas of ongoing research.